Aloha and welcome to Is This For Real? I'm Gregory Dunn, President and CEO of Hawaii's Better Business Bureau. Here with us today is Elliot Kano, the Administrator of the Adult Protective and Community Services Branch of the Department of Health, to talk with us about how you can protect yourself as a kupuna in our community and how you as a community can help protect your kupuna. Elliot, thank you so much for joining us today.
I'm glad to be here, Greg.
Really appreciate it. You know, your division is one of those that people may have an assumption about, but don't really know exactly what you folks do. Can you tell us a little bit about yourself and what your division does?
Okay, well, again, my name is Elliot Kano, Administrator for the Adult Protective and Community Services Branch. We operate statewide. We do have offices on each of the islands. Maui covers Lanai and Molokai. Our mission basically is to provide protective services to vulnerable adults. And the definition of a vulnerable adult is adults aged 18 and older that have some form of...
Not just seniors.
Not just seniors. So we're 18 and older that have some form of disability that negatively impacts their ability to function on a daily basis. Unfortunately, 80% of our clientele are 60 and older. So we do focus a lot on the elderly population.
That's really an astounding statistic in terms of the number of folks you've got to watch out for. And you know, a lot of the seniors in the community are shut in. They don't have a lot of people watching out for them.
Well, there are a lot of seniors that are isolated. So by our agency partnering with the many other nonprofit agencies, condominiums per se, assisted living facilities, we try to get the word out. We also try to educate and encourage family members to maintain contact with their loved ones.
So you do a lot of education and prevention and good things on the front end, it sounds like.
Yes, we do, because we know that prevention is a good thing to have. We don't want to wait until a vulnerable adult is abused, neglected, or exploited. So we take that extra effort by having our sections on each island go out and do in-service trainings for not only mandated reporters, but also to civic groups and those agencies that do support the vulnerable population.
Now, you used a term just now that I wanted to key in on. You said mandated reporter. What does that mean if someone's a mandated reporter?
A mandated reporter means by statute that if you are providing some kind of social service, whether it be a social service agency, private, nonprofit, or even public, hospitals, assisted family facilities, care homes, they're all mandated reporters. If they suspect anything that's amiss, that they should be calling our reporting line and discussing that.
So when we talk about anything that they may suspect, I mean, that covers anything from physical abuse, mental abuse, financial abuse, family,
neglect. There's
neglect.
Like caregiver neglect. Caregiver neglect is our number one concern. Second to that is our self-neglect. We have individuals out there that are just not able to, take care of themselves. So in essence, what happens is their health deteriorates to a point where it could be life-threatening or serious permanent damage. And third, and rising, is financial exploitation.
So we've got caregiver issues. We've got people that are aging in place that have their own challenges that they're dealing with, and then you've got the financial abuse. So if we pretty talk about those in terms of, if I'm a person that has a family member that's aging in place, and I'm concerned because I may suspect that there's something going on with the caregiver, what are some of the red flags that I should look out for, and then what are the things I could do to help end something that may be happening?
Well, one of the first things that we encourage the support systems to visit their loved ones in facilities, whether it be a care home or a nursing facility, and try to do it unannounced. If they always insist on you making an appointment, then that could be a red flag. So you want to drop in unannounced and see for yourself how the care is provided, and monitoring of the care and services to your loved one in the facilities.
I can speak from personal experience in that. I had a very good friend of mine, an elderly gentleman, that had an in-home care person that was taking care of him in his final years. And for me, one of the things I remember being really concerned about was when he told me that she was always short on money to buy the groceries, and he had to give her his ATM card with the PIN number to go down and take money out to buy the groceries. That made me concerned. Is that something that, is a red flag that?
Well, that is a red flag because normally the cost for your care should include all of the necessary provisions. So if a caregiver says, I need extra money, then that would be a red flag. If it comes to our attention, we want to see how often the withdrawals are being made, how much, and we would inquire that way.
Yeah, so it sounds like there are a couple of things for folks to think about when they're contracting for the service. First of all, is that look at the contract, what's included, what can you count on or rely on. When these contracts are set forth, do you find that it's something that the family sets up initially, or is it something that the senior sets up initially? Or?
Well, if it's a private arrangement in your own home, bringing someone in, you want to make sure that the individuals coming in are licensed or certified.
So the state has a licensing?
Yes.
Okay.
Yes, and that's through the Department of Health, the Office of Healthcare Assurances. They will license care homes, nursing facilities, and they have a licensure contract to license and certify nurse case aides. So certified nurse aides.
So I know that at times if you're with a loved one at the hospital and it's time to consider that type of care, you're given a list of different providers and they say, okay, pick one. When people are going to pick that, they're going to look for licensing. Does the state have, or do you know of any other resources they could look to besides the licensing or the Better Business Bureau even to look on that website for information on folks to contract with?
Well, first you work with your health plan. If you don't have a health plan, then you want to try to see if you can qualify for Medicaid if you're a senior. Okay, then a health plan will be assigned, or you would have a choice as to what health plan you want to join. And through the health plan, they have case managers that can provide you a listing of all the case management agencies in the state. And if you do your due diligence, you can check with the Department of Commerce and Consumer Affairs. They have registries. You can check to see whether or not there have been any hits in terms of concerns regarding these individuals. And you just need to go out and meet the care home operators or meet the individuals that will be providing the service and interview them and have a feel in terms of their experience, their commitment, to caring.
Excellent. That's really great information. Once you get to the point where you've chosen someone, you're in the situation, let's say you start seeing some of those red flags that we talked about earlier. What's the best way to address those or deal with them?
Well, there's many things you can do. You can call Adult Protective Services and have a discussion with our intake workers. You can call the health plan. You can call the case managers of your health plan. If you feel that there are some licensing maybe violations, the care home is not, in your estimation, sanitary, there's odors, or you feel that the care is not being provided timely and responsibly, then you can call the Office of Healthcare Assurances. They're responsible for licensing these homes and do inspections.
So there are ways for folks to ask for help.
Sure.
But I know a lot of times that people are embarrassed or afraid, or maybe they think it's not that bad. I mean, would you encourage people if they're concerned to not wait, but to?
When in doubt, if you have a suspicion, make the calls.
Yeah.
Yeah. I mean, it's not going to cost you anything but some time. And in fact, having conversations and discussions might put your fears to rest, or someone will be looking into the situation. So.
Yeah. So there are protections in place, and
Yes.
it's no shame to call or ask for help.
Correct.
That's what you folks are there for, right?
Right. And the Better Business Bureau has a call center, right? So they can triage calls coming in, and they can assist the caller that way too.
Right. Help put people to the right department
Right.
or right area depending
Right.
on the question.
Right.
So, if you, let's say that the second category of people that have self issues, let's say you have a family member, or maybe it's not even a family member, maybe it's a neighbor. We have a lot of folks that don't have family that live near them. What's the first step for getting people assistance or getting them help?
Well, if the call comes into our reporting line and there's suspicion that there's someone isolated, that they might be neglecting their care of themselves and they have no support systems, We do have a diversion program. We would send out a social worker and go out and try to engage the individual. Our services are strictly voluntary. We cannot force ourselves upon, these clients that may be in need of assistance. So we'll go out and try to engage them and just, befriend them, talk story about, how they're living, if they need anything, what can we do to help. And then from there we can get in the door, do our assessments, and try to talk about services or remedies that might, help them.
Can you think of any situations in the, recently that you folks, not with giving any personal details, but anything that, because I can envision in situations where there's a lot of people out there that do need assistance, but they don't know what that looks like. What are some
Well,
things
I mean, we have some cases across the state where a person is self-neglecting. They, let's say, have diabetes, and without their medication management, their limbs are being affected. Gangrene sets in. We go out there, we see the situation, we want them to get the help. Sometimes they don't want the help, so we try to bring in a nurse to see if, in-home care can be provided. We've seen open wounds on individuals that they don't want anybody to do anything about. So it's very kind of depressing and tragic, to see these. And some of them have expired over time. Even though we have efforts going in every week, checking in on the individual, trying to get them to comply and agree to get some treatment. Sometimes it doesn't, work out for the best.
One of the things that's important, I think, to remember is in a case like this where someone's made a call and to you folks and your staff go out and make contact with the person in the community. When they make that first contact, they have identification, they identify who they are, what can people expect if they receive a call from your department?
Well, normally our visitations are unannounced, so we would appear at someone's home, let's say. We would identify ourselves. We do have a departmental ID badge. We have business cards. And most times, if it's a case where involving health issues, we have an RN with us. So, it's there to make contact, to say, hey, we got a concern, a call of concern. Is there anything that we can do to help? And start to get the conversation going. And then delve into the allegations of concerns that came into the office.
But you folks won't barge in and say, oh, we're going to arrest you, or we need your money, or we need you to give your social security number. We give personal information. So
no,
it's much more conversational and focused on the
engagement. Although we do have the right to entry, we wouldn't be busting down doors. If there is a safety concern where there is a alleged perpetrator, then we may leave the front steps, go to the curb, call for police assistance, then we'll go in with the police. But very rarely that happens. We just want to be more of a support, a helping hand to the individuals.
The reason I asked that question is we hear a lot of times about this next part that you talked about, which is the financial abuse part. And for seniors that are shut in and they don't get a lot of visitors, having someone show up at their door, and most recently we had a case where people were showing up with a bouquet of flowers and a bottle of wine. And they're telling the senior that, oh, someone sent you flowers and a bottle of wine, but you've got to sign for it, and the only way you can sign for it is with your debit card. And they've got one of those little pocket scanners, and they zip the debit card through. And then they have them put the PIN number in, and so and then they give the senior the wine and the flowers, and the person leaves with the debit card information. And so it's important for people to know that when a state agency comes to the door to talk to them, you have the ID, you have the reason for being there, and you're not going to ask for payment.
Right.
So
our services are free.
Yeah.
And when we're trying to engage the individual, we want to offer these services free. There's no cost associated with that, just your time.
Right. Yeah. Now, on the financial abuse side, let's talk a little bit about that. What does that look like? When we say financial abuse or financial fraud, people think like, oh, big, like Enron, big scale stuff. But hard things happen to people locally when they get taken advantage of. Give us some examples of what that looks like.
Basically, financial exploitation is the misuse of someone's funds without their permission or without disclosure as to what they're going to use the funds for. We have situations where an individual is in an assisted living facility and there's monthly costs for their room and board and services, and the responsible family member or legal guardian is responsible to make payments. And cases come to our attention when the care homes are saying, hey, we're not getting paid. We're not getting anything. Then we look into the situation. We may find out that the caregiver or the responsible party is not paying the bills, obviously, but using the money for other means. Could be for personal expenses, luxury items, and so forth. And that's how it comes to our attention sometimes. It's just by happenstance.
So happenstance that a lot of times it's the care home or someone's not getting their payment, and because that's kind of scary for a senior who's got a roof over their head that's being paid for by their money that's trusted to someone else.
Right.
And if something like that happens, you get the call from the care home. What if there's another family member? Sometimes we see that person that's entrusted with the money is maybe a son, a daughter, a grandchild, and another family member finds out about it. What do you suggest that those familial relations do?
Well, we as an agency can try to assist the family and mediate and determine what is in the best interest of the client, who can do what responsibilities. Of course, police may be involved, because if there is that exploitation component of it, they could be involved. But our perspective is to ensure that the safety and well-being of the client is addressed.
And the client is the senior.
Is the senior, right? And that they are in a place, they're aging in place in the environment, the most least intrusive environment for them. So we're not a punitive agency. We're there to help. We're more client-focused. Yes, we have to investigate and determine and come to findings as to whether or not the allegation, let's say, of financial exploitation more likely than not occurred, the preponderance of the evidence or not. But then everything focuses and shifts to the client. We want to make sure that the client, is going to be living in a safe environment.
So let's say we're sitting back and we're looking at, we think there might be something going on. What are some of the things that people should be aware of? What are the most common frauds that happen under that umbrella of financial abuse that people should be wary of or concerned about?
Well, it's promising. We have promising work and goods service. We have that. We have some that's going to take care of all of your expenses, and you don't have to worry about those kinds of issues.
So like one is like contractors or home services,
right.
someone that shows up at your door and says, like one we heard last week was, summertime, so there's home repair going on, and someone knocks on Auntie's door in Manoa and says, oh, we're up the street paving a driveway, and we're going to have some extra asphalt. It looks like you could use a top coat, if you'd like, I can sell you what's left, and we'll just do what we can. And they're like, oh yeah, and so okay, we'll just sign this blank contract, and next thing you know, $20,000, $30,000 they fill them in, and the senior is on the hook for that.
Well, yeah, that happens, unfortunately. It's always like cash on delivery is better than paying up front, because they're not going to show up after you give them the money up front.
Right.
So we have those kinds of concerns.
So you've got that one, we had that, then you've got the next one that you were talking about.
About the responsible parties not paying for the expenses of the individual in care, using monies for their own ill gain. We have those. I've heard examples of the love scams and those kinds of things.
That one's so
sweepstakes. Please send X amount of dollars and for the administrative fees, and then you'll get your $10 million subsequently.
I talked to my mom about that last week.
Yeah.
Someone called her and said, oh, you know what, congratulations, you qualify for a government grant to help you. All we have to do is get your paperwork going, and it'll be $100,000, and you'll be qualified to get up to $350,000.
Well, one example that that hit home personally was if you have a kupuna and they have grandchildren, and when someone when they pick up the phone and someone says, "Hi, Grandma," don't say, "Is this Ryan?" Let them say who they are. And of course, if you say, "Is this Ryan?" and Ryan says, "Oh yes, Grandma, this is Ryan. I need help. I'm in Mexico, and I lost my wallet. I don't have any money. Can you, what do you call it? Western Union? Yeah, wire some money to me." And that happens a lot too.
Yeah, that one happens quite frequently during vacation times because you don't know where your grandchildren are or what they might be doing.
So the response to a grandmother, my mom, is she said, "Go call your father." Yeah, but I did talk to my mom, but she did call me and say, "Hey, I got this call, and is Ryan in Mexico?" I said, "No, he's home." But I said, don't volunteer a name. You always ask who is calling. So that was a personal
that's a good one.
experience.
Yeah. It's like to don't volunteer the name, get a phone number to call them back is another good one, and then call the parent or another relative to confirm, are they really in Mexico? Is this for real? Right? It's like,
exactly.
because it's the people that are perpetrating these frauds are trying to get you caught up in the heat of the moment.
Correct.
They want you to, because you want to take care of your grandchildren, right?
Yeah.
You want to help them if they need it, and that's what those people are counting on. You're going to jump right to it.
Right. In our senior population, they've settled, they've achieved successes and everything, so they do have the money. So they are our most targeted, exploited population. Young people starting out, don't have that much money, so they're spared.
It's really hard too, and it's terrible because the seniors who have amassed that money, that's it in most cases. They don't have the ability to replace that money once it's gone. So it's particularly devastating for this population when they're taken advantage of.
Right. There was a case that was in the paper a year or so ago in Hawaii Kaya where a woman, elderly woman, was befriended by a younger woman, came in to help her and end up living with her, and the deed of the house was transferred over. So the property, we got involved, police, prosecutors got involved, there was some successful prosecution. The home was sold for $300-something thousand. The money was recouped. So there's some good stories, but it has to happen quickly. If they delay in reporting and intervention is not timely, there's a possibility that you cannot recoup the losses.
So it's one of those things that when you feel like something's wrong, you've got to say something right then.
Right away.
Do not wait. It's
Right
like
away.
don't be ashamed. Don't feel bad about saying I need help or I've got a question. There are resources in the community available to help you evaluate and find out what's going on for real.
Right, and the Honolulu Prosecutor's Office has an elderly abuse detail, so they receive calls directly too. So they're on top of things.
And those folks are specially trained in dealing with seniors, as I understand. They've gone through training on how to communicate, how to make it painless, how to interface and be available to you. It's one of the things that even with the Better Business Bureau, that's why we still have people that answer the phone, because so many seniors don't have access to the internet or don't use it. And so to be able to have that direct connection is important.
Yeah, very much so. I mean, you need to have a warm body and a warm response. It's hard enough for them reaching out, that's why. So,
well, in terms of family members and supporting, what do you feel is important for family members that may be watching? How can they best support their elders to make sure that they're doing the right things?
Well, one obvious thing is to maintain regular contact with them. Visit more often than not, especially if they know that there's a lot of exploitation floating around out there. Maintain more contact.
I mean, I think that the exploitation happens a lot more than people realize, that it's underreported.
I think some national numbers was like 1 out of every 40 cases get reported.
Only 1 out of 40 cases.
40.
So you have 40 cases, only 1 of them gets reported.
Yeah, like 40 situations going on, one gets reported.
That's just astounding.
And it's a multi-billion-dollar loss to individuals.
We were talking about it earlier, but before we sat down to do this filming, and one of the things that people get these calls that come in on the phone that like, oh, I hear your computer's broken, and they're calling from a call center in a foreign country, and it's big business. I mean, we're talking about massive criminal enterprises that are preying on individual people. And you know, we talk about the individual instances of abuse and financial abuse in the community, but we oftentimes miss the fact there are these larger operations out there that are taking advantage of people as well.
Well, I would suggest that, you know, if a senior has a support system, whenever they receive inquiries like this, that they make it a practice that they consult with their support systems first. And then, you know, and like you say, ask for a callback number so I can get back to you after you do some research and consultation.
Yeah, because it's one of those things that it's not really giving up any control. It's just getting the best advice.
Correct.
You know, it's I know that as we're getting older and we you know, lived a long time and we know what we want to do, but it's always good to get that second opinion. It's kind of like going to the doctor, you know.
Always good to have a second
Always
opinion.
good to have a second opinion. I just tell people you want to know who you're talking to and research it, find it out. And if you're not sure, and even if you don't want to ask your family, call you folks.
And they can remain anonymous. We don't record any of our conversations. You know, we don't, and even if you were to identify yourself, your confidentiality, your identity is strictly confidential. So.
And this is all free. You're not going to ask for any payment. It's like, it's a service that you folks provide.
Correct, yeah. Our challenge, for funding is through our department, through the legislature to get the appropriations because of the growing tsunami. Everybody talks about that. So we have advanced our services to a point where we can identify what we need in terms of resources. But that's going to be an uphill battle to get the resources. So we're looking from within to maximize our you know, manpower and to maybe make some changes, reclassify some positions to positions that we need. It could be like financial auditing. We have one financial auditor for the whole state in Adult Protective Services. And we know that the numbers are increasing, so we could possibly increase that resource.
Well, Elliot, you folks provide just such a tremendous service to the community, and I know that you've dedicated the better part of your career to helping out this segment of the population. I just want to say thank you and for that, and also thank you for joining us today. We really appreciated the great information, and you're helping out innumerable people with this. So hope you'll come on again. So. And I want to thank you for joining us today. We very much appreciate your time and hope you learned a little bit about protecting elders from financial abuse and other matters. Thank you for tuning in to Is This For Real? I'm Gregory Dunn, President and CEO of Hawaii's Better Business Bureau, wishing you a fond aloha.